My name is Fred Hayward, and this is my colleague, Professor Amobebari. Our paper focuses on the problems of mental health of young people in universities, and we look at some of the problems, some of the background, and some of the strategies that the Ministry of Higher Education might take to improve the situation.
As a result of the war, what we had in higher education, it was just ruin. The situation was very critical in terms of infrastructure, in terms of the access to higher education. But during last 10 years after 2002, there are many achievements in terms of higher education, in terms of building a new system of higher education which could be responsive to the need of the Afghanistan communities, infrastructure, faculty developments, in terms of making our institution responsive to the need of the community and make them objective-wise.
Let me say a few things about the context of the mental health situation in Afghanistan. We looked at this problem using a modified Bardak's method, that is, defining the problem, assembling evidence, constructing alternatives and recommendation, and then telling the story. As the Deputy Minister has said, the war continues. At least 12,800 civilians have been killed to date. 3,000 police and military have been killed since 2006, and the war is ongoing, and it touches almost everyone's life. The health system is weak. There is only one mental health hospital in Afghanistan. There are 8 mental health clinics, and very few people trained to deal with mental health. There have been a number of studies about mental health in Afghanistan. One study points out that 22% of young people have mental health problems. The study done by the U.S. Center for Disease Control of people 15 years and older found that 72% of the sample were suffering from depression. And a 2009 study by Panterbrick and others found that post-traumatic stress disorder affected 24% of students between the ages of 11 and 15. Girls suffered twice as much as boys. The Ministry of Public Health has estimated that over 2 million Afghans are affected by clinical mental health problems.
The problems that we see among students, they are depression, post-traumatic stress disorders, anxieties. Most of this problem is very common among female than male.
Let me just say a few things about possible directions for the Ministry of Higher Education. We are working with the Ministry of Health to find solutions to these problems, and we hope to set up a pilot project in a couple of universities later this year in connection with the existing student centers. We're also working to train to find a way to get more trained mental health workers. We're in the process of establishing social work at Kabul University, and we hope to have a program that will be training psychiatric social workers. Also in guidance and counseling, there is some training going on, and we hope to increase the work on mental health.
The Ministry of Higher Education of Afghanistan is currently laying the groundwork to establish mental health program at all higher education institutions. As my colleague stated, we are developing the new strategy for the mental health based on our National Higher Education Strategic Plan, and we will have our action plan in this regard, and we are very cautious and committed to treat this problem in a good manner and way. Thank you very much.
Thank you.